Hi, this is Dr. Sylvester, and I'm going to talk to you a little bit about why you might want to consider Next Step Foot and Ankle Clinic if you have flat feet as an adult. Flat feet as an adult can cause a lot of problems. We see it a lot in patients that have to work. They're the sole provider in their family or a major provider of income for their family, so they're working themselves to death on a hard surface, and eventually the foot starts to collapse, and that's a very difficult thing. The first reason I think you ought to consider us is our orthotic device. If you look on our other video on orthotics, why you should consider us, you'll see that we have the most, I think, the most sophisticated orthotic generating device on the planet. So we can support a foot in a good position. The second reason is we use a lot of AFOs that a lot of doctors don't get involved with. They're devices you can wear on the foot to keep the patient working that don't really interrupt their life but help protect the foot and allow them to function. Third reason is if you need a major, usually a lot of times with those kind of feet, what has to happen is you have to fuse joints to stop them from moving, to stabilize the foot underneath the leg. And if you need that done, we have a great surgery center right next door where it's really easy for the patient. There's not a lot of exposure to other people that have COVID. We do those kind of procedures all the time. Every week we're doing a procedure like that for a patient where we're fusing some joints to try and get the patient stable. It's not the greatest procedure to have done, you know, because it is kind of, you're saying, okay, we're going to sacrifice this joint to make this foot better, but it certainly makes patients a lot more functional and be able to walk a lot longer and be on their feet a lot longer. So a lot of clinics don't do those kind of procedures. A lot of clinics are, the doctors just aren't trained in those rear foot procedures, and they don't get involved in those. So I think that if you have a rear foot arthritis or collapsed foot problem where you're having a lot of pain and difficulty, you probably ought to consider our clinic, because we do a lot of those procedures. We're very familiar with what works and you know, tragically what doesn't. So thanks for listening.